Hi, I'm Dr. Malaraj, endoscopic surgeon from Chennai. So I had an opportunity to operate in this wonderful IAGE national conference today here in Apollo. So this was a case of multiple fibroids for which laparoscopic myomectomy was done. So we removed almost 4 myomas, and apart from that there was also an adenomyoma which was also removed. And apart from removing the myoma, the most important step in myomectomy is the tissue retrieval. So in this case, because it was a multiple myoma, we did a myoma stringing where all the myomas were strung together, formed into a mala and kept aside to prevent losing of the myoma. Prevent losing of the myoma. And then finally we used an in-bag morcellations to make sure that we do not leave any bits inside the abdominal cavity while morcellating, for which we used a LIMAS isolation bag. So it is a very nice bag wherein so they have various sizes. We use the largest size because it was a multiple myoma. We put the bag inside. So the bag, in fact, it is quite beautifully designed in such a manner that it has both anterior and posterior flap. The posterior black one and the anterior will be the blue or the purple one. So once we introduce the bag, we have to maintain this alignment so that there is no twisting of the bag. So once this is done, we can pick up these myomas and drop it inside the bag. The advantage of doing the myoma stringing in this particular case was that because I had strung all the myomas, I had to just pick up one string and all the myomas just immediately went into the bag. So that is an advantage, additional benefit, so that you don't waste time running behind each and every myoma and dropping inside the bag. So once this is done, then next step would be to retrieve the tail of the bag outside, so that we are now able to create pneumoperitoneum inside the bag, for which the railroading of the tail was done through the opposite port, through the camera port, and the tail was brought out. Then a small little nick was done on the tail, and then the trocar was introduced through that little eye, and then the pneumoperitoneum was created. So once the pneumoperitoneum is created, then the LIMAS morcellator which was about the 18 centimeter size, 18 mm size, was introduced inside the bag, and then once the pneumoperitoneum was nice and well maintained, we started morcellating. So all the myomas were removed without any kind of a spillage, and we found the morcellator also very effective. So I would like to thank the LIMAS company also, Mr. Lalu is here, so for also providing us with the bag and the morcellator. And here in Apollo, we have a very excellent team of anesthetists, the gynecologists who assisted me, and we have all of them here to for giving me this wonderful opportunity to demonstrate this case.
And Dr. Mala has done an excellent job. She has done wonderful. Please take a break.
Thank you so much.
Yeah, I think. So we have seen one wonderful surgery, and the way you did the morcellation, excellent.
Thanks a lot. Thank you so much.
Say that 18mm
morcellator is also very fast. I have the experience of using this LIMAS morcellator for a long time. It's really wonderful. There are 4 sizes, 10, 12, 18 and 20. And when you are using the 18 or 20 size, it's very fast.
Yeah.